Over the years, MS TeamWorks has shared different perspectives on MS from patients, care partners, family members, and healthcare professionals. Guided by our mantra, I have MS, I have a team, I have a future, we are proud to share new messages of hope and inspiration with the MS community.
I have MS.
I'm on your team.
I have a future.
My name is Amy Perrin-Ross. I'm a neuroscience APN in the western suburbs of Chicago, and I co-manage the Multiple Sclerosis Center. We see about 2,000 people every year with MS, and I basically help to manage the intake of new patients, symptom management, relapse management, choice of disease-modifying therapy, getting people started on disease-modifying therapy, troubleshooting side effects, and basically just assisting people to live their lives to the best of their ability with MS. Before you come, or even as soon as you leave the appointment, I would start planning for the next appointment. Think about questions that you may have, issues that may arise, things you're not quite sure about, things that maybe are not enough to prompt you to call your healthcare team to ask a question, but you would like to bring it up at a future visit. Start to document some of those things, and then a couple of days before the visit, go through the things that you have written down and decide how many of them are still relevant. I often then ask people in my practice to prioritize those things, because heaven knows in today's society with limitations on time and resources even in a big MS center, we need to be able to address the most important issues for each individual patient, and I don't make the choice. I want the person with MS and or their family members to choose what's most important to them. So I ask them to rank the top 3 or 4 or 5, realizing we may not get to all of those issues in one visit. We may have to schedule another visit, or I may ask that they be scheduled with another healthcare provider, perhaps a physical therapist or an occupational therapist or a nutritionist, speech therapist, based on whatever the issues are. Now, there are a number of good tools that are available for people, apps that are available through, for example, the Multiple Sclerosis Association of America, MSAA, has a great app that is free and accessible to people with MS. You can enter a multitude of things, including symptoms of the disease, what you think might be side effects of the disease, side effects of medication, questions about lifestyle and medication and those kinds of things. You can prioritize those. You can track your own therapy in those handouts. You can track injections that you may be giving, track the oral medication that you may be taking. Think about scheduling future infusions for people that are on fusion therapy. So there's many, many resources within that app. And there are other apps. Certainly we could look at the National MS Society, we could look at the MS Coalition, a number of different groups. I like the app from the MSAA, basically in terms of the way it's organized, but I'm happy for whatever the patients are comfortable using. What I don't want, though, is, as a busy clinician, someone to come in and open up an app and have months and months of data on there that I just, in a clinic visit, don't have time to review. But I want the patients and their care partners to use those apps to go back, take a look at what's going on in the last 3 months, and see if there are issues of concern. Sometimes what's going on in the previous 2 months is long since forgotten if there's a current issue that comes up, and I don't want to lose those trends. So I ask the patients and their care partners to look back and help me identify what, if any, trends there might be. So when do I recommend that people be accompanied by someone? Whenever possible, to be very honest with you. A disease like MS, even if it's a disease you've been living with for 30, 40 years, is still a complex disease, and it's going to throw curveballs your way every day. And I'm a true believer that regardless of whatever the health issue is, if you have someone, a spouse, a family member, a trusted friend, someone that you work with in terms of their ability to be another set of ears for you, if the healthcare provider is asking questions, if the healthcare provider is giving advice. Many, many times, I personally will get calls from patients who say, well, the doctor told me this, but then I don't remember what else he said. Or, you and I were talking about that, and I forgot the last two things. Again, having a care partner or family member, friend, whatever, doesn't mean you still won't forget this or that, or you won't misinterpret. But whenever possible, I encourage people to bring someone with them. Certainly if we are dealing with someone who relies on a care partner for activities of daily living, these people may be able to walk and talk and dress themselves in a multitude of activities of daily living, but perhaps they have some cognitive problems. So they're no longer able to handle things like banking or credit card payments or, doing taxes or some of those kinds of things. There's enough cognitive impairment in a person that a care partner needs to step in. I really like that care partner to come for a visit as well. A lot of times I think the care partner is willing to be open and honest about things. Certainly they have another perspective on what might really be going on. I learned that even in talking in my own family, and people's perceptions of how a certain event went are very, very different. People's perceptions of what someone said and what the intent behind that statement was are very, very different. And so we need to be able to have a multitude of perspectives to truly get a good idea of what's going on so that we can provide the best assistance to our patients. First and foremost, when my daughter was a teenager not so many years ago, I flat out banned her from websites that provided medical information. Why? Fortunately, she doesn't have a disease, so she doesn't go to a disease-specific website like the National MS Society or the MSAA or the MS Foundation. She was going randomly Googling things, and of course she would, every symptom she typed in, they would come in with a morbid diagnosis. I think if people don't carefully choose their websites, the kinds of information they can get are unbelievable. And if they come to me having really researched something on some websites that are not necessarily terribly credible, or worse yet, joining into blogs where people are really venting, I end up spending most of their visit undoing what they think they know. So I ask them what websites they have visited. I make some strong recommendations for some great websites, because there are many, many great websites. Each one of the pharmaceutical companies who support people with MS, who provide medication, either oral, IV, or injectable, they all have websites specific for the MS population. And most of those websites don't require that a person be taking this drug or that drug. They have wonderful resources. So I always refer to those kinds of websites. As I mentioned, the MSAA, the National MS Society, the MS Coalition is also another website, another organization that is made up of multiple groups, the Multiple Sclerosis Foundation. All of those are good places to look and good places to start, and perhaps to dispel some of the myths that get propagated on perhaps less than credible websites. The main thing I want people to remember after watching this video is that you, as the person with MS, and your care partners are in charge of you. Your healthcare team should be there to support you in any way that they can, whether it's rehabilitation, physical therapy, speech therapy, nutrition, medical advice, side effect management, lots and lots of resources. But you need to remember that you and your care partners are at the center of the wheel, and all of the spokes are the team members who are there to support you in your journey with multiple sclerosis.